Good morning, everybody. Thanks for joining us today for our monthly meeting having to do with the strategic plan. Thanks to Myra and Michael for presenting to us today. Just a few housekeeping notes. We are recording this meeting today, so it will be disseminated in the Friday update as soon as I have it available. If you have questions or concerns, feel free to just let me know. There are surveys that are linked through the QR codes that are on the tables in front of you. Please just make sure to fill that out today. That would be lovely. Thank you. And then if you have any topics that you would like to see for upcoming monthly meetings, please also feel free to let me know that. So with that, I will welcome Myra to come up and get us started.
Test. Okay, welcome everybody. Thanks for taking time out of your busy days to join us today. I do want to give recognition that the lunch you're enjoying today is courtesy of the hospital in recognition and appreciation. And Dr. Jean Kuttner is going to be by later on today to speak to us all. But so welcome. And today's meeting, we want to focus on the strategic plan to give you an update about what's been going on since we started this whole adventure back in about August, and where we are today. I just said that, yeah. Oh, there we go. Okay. So our goals with the strategic plan were to determine where are we, like what is our today state, and that began with an environmental assessment that included kind of a deeper dive for the details describing ourselves, how many people we have, how many faculty, how many staff, how many residents, our research portfolio, stuff like that. And then it also included an interview of 8 institutional leaders across the campus, including like Dean Riley and Fulbriggy, someone from Denver Health, and Vineet Chopra, Department of Medicine chair, as well as some other individuals, Tom Gronow. And we also said, who are 3 other family medicine departments of similar size and similar stature that we would consider benchmarking departments, and how do we stack up against them? And so we compared data with them, and they in turn got our data to see. And then we asked them a really critical question. What do y'all think about the Department of Family Medicine at University of Colorado? Because it's hard to get that information. And so this was, anonymous on their part, but we thought that would be really valuable to, what do our peers think about us as a department? And then we thought about the next goals, or where we want to be, our strategic vision, and then finally the strategies of how we're going to get there. Oh, okay, thanks. Well, is it better if I just sort of stand here? Gotcha. Like here? All right. All right. Well, then I'm closer to the advance button anyway, so. I want to say thank you to the steering committee. This was a lot of work. These were not hybrid meetings. They actually had to come into campus to participate, which was really critical in our interactions. So specifically, I want to call out Gilbert Ache, Brian Bacek, Heather Bleacher, Chandra Brown-Levy, Michael Cahill, Liz Campbell, James Chin, Colleen Connery, Rose Crompton, Kristen Churchia, Mark Deutschman, Chloe Fink, Cheryl Harrington, Jody Holtrup, Corey Lyon, Venus Mann, Linda Montgomery, myself, Andrea Netterville, Sean Osser, Cleveland Piggott, Surab Podar, Michelle Pretzel, Rachel Rodriguez, and Roberto Silva. So you can see this is really drawn for a really wide cross-section of our department. So a little bit more about the timeline here. So we started with that environmental scan, which included the stakeholder interviews. There were groups of you that participated in focus groups. And the stakeholder interviews were people within the department and then also the institutional leaders. Then we asked the stakeholder groups and institutional leaders about their thoughts on our strategic priorities. And then we also did a department-wide survey, and I'm very proud to say that 63% of you all participated. So, and our consultants told us that typically they're used to getting more like 38%. So I'm really confident that our strategic plan really represents the will of us as the people of this department. Then we had the external peer benchmark assessment, like I said, and our own internal scan. Then October and December, we looked at all that information. Our consultants really consolidated a lot of information, gave it back to our steering committee. And we went over those findings and said, okay, what does that mean about where we are, where we need to go forward? Then in October to December, we spent meetings defining our strategic direction. Where do we want to go? What are our goals? We reviewed those scan findings. We began to devise our vision for the future. What's our big, hairy, audacious goal? Look at our core values, revisit our mission. What were the goals to support our vision? And then began developing those strategies and tactics to support the vision and goals. So we came to January, we had our final strategic planning meeting and sort of developed a roadmap and said, out of our priorities, which were the top ones that we want to tackle first? Doesn't mean we won't get to all of them, but what were we going to aim to tackle first? And then we started the process identifying strategy champions. So for the strategies, we want to identify people in the department who are prepared to lead that strategy area, look at the tactics and the metrics to see if we're making progress, and help us get this over the finish line. So now is our plan. Mission. When we polled ourselves, we found that over half of the department really felt that the mission was not fitting anymore for them and they weren't really relating to it. So this is the mission that we came up with, the steering committee. And to heal, teach, discover, and connect together. And the together part is really important. Those first four really encompass the missions and how we aim to make the world a better place. The together part speaks to the desire of our department to be less siloed, to come together, to know more about what each other are doing so we can work together. Fortunately, we're a department, we basically like each other most of the time. So we like doing things together. And how can we do that to improve the world, make it a better place? And doing it together, we're going to have more fun doing it. The vision, our big, hairy, audacious goal. We will transform health, healthcare, and well-being for all. Again, together. And we will keep coming back to the together part because that speaks a lot to who we want to be and how we think we're going to get there. So that's a pretty big goal, pretty enormous. Even together, you know, it's gonna take a while. We won't accomplish this overnight. So how does it happen? We'll break it down into steps. And with that, I'm going to turn it over to Michael to present some details here.
Thanks, Myra. I get the fancy one. We figured that out. Thanks, Myra. I did notice in the first couple of slides, there's a game you can play of how does the memory stick work and transfer. And it looks like the word tactic became an S throughout that. And that's a first for me. So, if I knew that was going to happen, I'd say we have a prize for everyone that can call out whenever tactic should have appeared, but didn't. Alas, we can just point and laugh as we go along. Like Myra said, this is an enormous undertaking. And so how is it, what are we going to do to get there? And quick show of hands, who was around for the February department meeting? Okay, so I noticed a trend that you guys might notice as well, because I got to present on the budget last month. And it turns out I like large circles on slides. I didn't realize that. Here we are. I will work on various shapes for the future, but we're going to stick with the circle today. So that vision, we will transform healthcare, and well-being for all together. Again, it's an enormous undertaking. And so it's on us to say, well, how are we going to get there? What is it we have to do in order to affect that? And you got to start piecing it up. And that's what we do, is that vision gets pieced up into key aims. So for us, there's 5 key aims that we're looking to accomplish. And they're related to patient care, research, training, community engagement, and our people. Again, these are in and of themselves enormous undertakings. So when we're looking to make an impact on patient care, there's a lot that goes into that. And I'm going to use that slice of the overall pie as an example here for illustrative purposes. So patient care, if we're looking to improve in patient care, and we are, there's a lot to that. And so what we're going to see there is it starts to get split up. Again, just like that overall vision, the goals are going to get split up. Or rather, the aims are going to get split up into goals. And so we're going to see, and I'll talk to this here shortly, specifics, but each of those areas, those 5 overall aims, have to be split up because, I can't, hey, Corey, can you go out and improve patient care? Right. And I believe that he can. However, it's going to take steps and bits and pieces in order for us to actually do something about that. In our case, these are getting split up into goals. And again, you're going to see a theme here. The goals in and of themselves are pretty large undertakings. And so the goals have to get split up. And you're going to see the goals split into strategies. You're going to see the strategies. I can't wait to see what tactics looks like here. You're going to have to believe me that that's what it said at one point. That's fascinating. Of all the things that could have taken out, though, I'm okay with that. So tactics is the strategies are going to get broken down into tactics. And we start to get a little bit more granular. We're going to start getting a little bit more, okay, this is something that we can actually do. This is something that can be accomplished. It's starting to look a little bit more realistic to that. And as it says up here, each project or each tactic, I'm sure it said tactic, each tactic has a project or a piece of work related to it in order to move that forward. And the other thing you're going to be able to see with these as we're laying this out is metrics or measures related to each of these as well to say, we tried something. Is it a move in the right direction, or do we now know how not to do it? And so it's to be able to say we're making progress, we're being held accountable to this, and accountability is not a bad word, I assure you. We're being held accountable to say we're making progress on this or not. Because the other thing that comes in play with a strategic plan is this is not going to, collect dust somewhere. A strategic plan is a living document, if you will. And in that this was, like Myra walked us through, is this was created based on what we know now, what exists now. And internal and external factors change over time. And so it's important for us over time to reflect on this, revisit the strategic plan, say, okay, this is the direction we wanted to go. And sure as heck, in 2024, that made a lot of sense. Is this still making sense? Do we still want to go forward with that? So know that this isn't going to be a passive document. It's not going to collect dust. Pick your favorite analogy related to that. This is going to be something we really work towards as we're going forward here. So that work has to happen some way, okay? So as we work together and with one another, there's guiding principles with how we accomplish our work. And I want to take the time here to walk through these because this is important. This is what we need to hold one another accountable to say, is this how we're going about our day-to-day? Is this how we're going about accomplishing our work? Is this how we're representing the Department of Family Medicine? And so there's six guiding principles here. So innovation. We embrace creative and progressive approaches fueled by curiosity to advance health and well-being. Collaboration. We foster effective partnerships and teamwork that enhance interdisciplinary approaches, knowledge sharing, and our overall effectiveness. Put in 3 words, we, not me. Compassion. We demonstrate empathy, kindness, and patient-centered care that prioritizes the health, emotional, and social well-being of all. And I want to call attention to this in that don't let the phrase patient-centered pigeonhole this to caregivers. This is not just at the bedside, this is at the desk side. Advocacy. We passionately promote health and well-being by championing the needs of the patients and the community. Integrity. We uphold the highest ethical standards in all interactions, ensuring trust and transparency in everything we do. Diversity, equity, and inclusion. We place the highest value on diversity, equity, inclusion, and anti-racism, creating an inclusive and just environment for all. And encompassing those is that circle of excellence, is everything we do with the highest intention of high quality, high excellence as our output. So let me talk to how this breaks out here. Is again our vision. Can't say it enough. We will transform healthcare, and well-being for all together. And at a high level, we are going to accomplish that through 5 aims. Patient care, providing outstanding family medicine to every patient. Research, create and disseminate new knowledge. Training, train a future integrated family medicine workforce. Community engagement, achieve health equity with community engagement and advocacy. And across all of that, our people. Nurture a thriving, diverse, and equitable DFM culture. Related to that, to me, I am thrilled to see people on there, first off, and that it is across all things. Because we can have, as I said with the vision, the biggest, hairiest, most audacious goal that we can think of. And without the people to do the work, without growing our people, without helping our people, it's a moot point. It's not happening. So that people aspect is a really key piece here. This is an eye chart for me, so I'm going to my notes. So you'll see on the bottom right there on the slide is just going back to how we were breaking things out here is I'm bringing that back here so you can see that this starts to piece out as we're going through this. And so on the left there are the key aims, those 5 key aims we just talked to. And you're starting to see these start getting broken out. You got this vision, this great vision, but how do we do this? And so breaking down those key aims to goals. And let me talk to them here. So patient care is broken out into two goals. One, optimize high quality patient care provided by the department. And two, bless you, demonstrate and promote the value of family medicine. The two goals related to research. Develop an internationally recognized high caliber, high impact research portfolio. And expand collaborative and interdisciplinary research and scholarship across the department and beyond. Training has two goals. Lead in preparing an outstanding, diverse family medicine workforce that will transform health and healthcare. And expand training opportunities to meet the needs of our communities. Community engagement has a goal. Together with our community, advance and advocate for the health and well-being of Colorado urban, rural, and underserved communities. Our people, that has three goals. One, cultivate a cohesive departmental community that nurtures well-being and curiosity where all feel respected, valued, and heard. Enthusiastically advance diversity, equity, inclusion, and anti-racism initiatives that support DFM members, patients, their families, and our communities. And then ensure a sustainable future for the Department of Family Medicine. So as the kind of got a Trivial Pursuit vibe, doesn't it? Is as our Trivial Pursuit slides expand here, is our goals or our aims become are broken down into goals, and like I said, is our goals get broken down into strategies. And I think this is worth talking through. So thank you for letting me read this because it is small up there. I don't want I want to give the due to these here. Is patient care. So that first goal gets broken out. It says increase the number of family medicine clinicians and integrated teams providing quality care for the urban, rural, and underserved of Colorado. Provide integrated, whole person, equitable healthcare. And strengthen collaboration with our health partners across Colorado and strategically beyond. That next goal, the two strategies are play a leading role in driving the transition to health-based care, or I'm sorry, value-based care, and position the department as an institutional and national, international leader in family medicine and clinical innovation. So those are the strategies derived for patient care. For research, strengthen the research infrastructure. Expand and diversify funding sources. Launch an approach for identifying and developing targeted areas of research excellence. And actively disseminate and promote the department's research and scholarship advances and innovations. The second, expand collaborations within the department and on the CU Anschutz Medical Campus, and strengthen research collaborations and engagement with community, state, and national organizations. For training, it's three total strategies. Proactively recruit, excuse me. Proactively recruit, educate, and train a broad spectrum family medicine workforce that reflects the diversity of the communities served. Train and mentor current and future leaders in education, research, patient care, and advocacy. Enhance current and launch new family medicine training programs. For community engagement, there's three. Through partnerships, nurture thriving communities together. Champion CU Anschutz Medical Campus community engagement initiatives. And identify and reduce health inequities and disparities in our communities through education, research, clinical care, and community engagement. Finally, regarding our people, strategies are promote and support the well-being of all members of the department across all sites. Ensure supportive and equitable infrastructure, processes, and transparent communication mechanisms are in place for all to thrive. Model inclusive excellence by furthering professional growth and integration of a DEIA lens in the department. Advance and support DEIA initiatives with key partners beyond the department. Ensure responsible stewardship of the department's resources. And pursue and expand diverse sources of revenue and other resources, including philanthropy. That's a lot there. And I want to be clear that this isn't something that's going to happen in the next 6 months. This isn't something that's going to happen in the next 12 months. It takes purposefulness and prioritization, and I want to talk to that. So with regards to the strategies, the first thing to do is identify the prioritization of the strategies. And this is what the steering committee undertook, and they identified 10 strategies at the guidance of the folks we brought in to help us through this, say, identify the top 10. And in doing this, it's not to say that the top 10 get done right away. It means that these are what we're identifying as our first priorities. There's still work, and I'll talk to this a little bit, but just to set the stage here is to, spoiler alert, to come is there's resource identification necessary for all of these strategies. What's it take to fully execute these? And so that's going to be an effort across all strategies, and it might be determined that, you know what, number 10, or rather number 11 and 12 up there, don't take a lot of resources, can be done really quick. That's going to change the prioritization a bit in terms of what's taken place first. But on first shot, this is what we're saying are our top priorities. And that's, first one is around people, and that's promoting and supporting the well-being of all members of the department across all sites. That's what floated to the top per the steering committee. And then let me just rattle down the rest of the top 10 here. Strengthen the research infrastructure, proactively recruit, educate, and train a broad spectrum family medicine workforce that reflects the diversity of the community served. Ensure supportive and equitable infrastructure, processes, and transparent communication mechanisms are in place for all to thrive. Ensure responsible stewardship of the department's resources. Launch an approach for identifying and developing targeted areas of research excellence. Increase the number of family medicine clinicians and integrated teams providing quality care for the urban, rural, and underserved of Colorado. Position the department as an institutional and national/international leader in the family medicine and clinical innovation. Through partnerships, nurture thriving communities together and identify and reduce health inequities and disparities in our communities through education, research, clinical care, and community engagement. So that's what floated initially to the top. And also that means that the others don't go away. You know, we only have so many resources. And when we talk about excellence and what we want to present, what we want to complete forward, we want to do with excellence, is you have to ensure that the resources, the timing, and the scope are in alignment in order to get that excellence. And this is a first step to say, from a scope perspective, here's what we're saying we should take on first. That's that first prioritization. So each of those strategies, again, coming back to this, ironically, to talk about tactics, is each of those strategies is broken down into tactics, but each tactic has the project or projects and work related in order to complete the tactic. And so, you know, one further way of breaking that down. So each tactic is going to have a level of work, and it might take a little bit of time. It might be fast. It might take 6 months in order to complete a project. But it's ensuring that there's the right work happening at the right time for the right things. I'll add on to that, by the right people. And for that is what's really slick about this to me is this helps ensure a line of sight between what can be, almost, I'll say like break room material. Oh, there's a poster of our mission and vision. Haven't talked about that anytime lately, It's how do you make this not, wall fodder, that it's just something you walk by, you don't think about because it's, it doesn't really have any meaning behind it. Our intention here is for this to have meaning. This is what we're aiming for. And so what I like about this is that line of sight to say, here's the vision. From that vision, here are the aims that we're going to do to tackle that. Here's the goals related to the aims. The strategies, starting to see like, how this run out of room really quick on the slide here. But then, down to that tactic, oh, sure, that one kept. Down to the tactic, down to the project. We can say, Veronica's working on that project, which, that's that line of sight to say, what I'm doing is having an effect on the department. And you slice that up. Each of those little, what are initially large slices of the pie, pieced out to say, down to the person, here is the work that I am doing in order to affect the advancement of the department. And that's an important piece because otherwise, I'll say is when I started here, one of the things I said was everyone has a right to be successful at what they do when they walk through the doors, albeit, literal doors or the virtual doors. We have the right to be successful at what we do. And this is one of those things that helps illustrate this, what I'm doing is helping the department be successful, and I'm being successful in helping the department be successful. And we'll see some growth of this. I'm hoping, me at work with Kelly, but that we can see this and create it in real time. Here's the work that's taking place. Here's what I'm working on, or here's what my peers are working on. Here's what its status is. Here's where we're going on that. And that goes again to the transparency as well. So like I said, hope we can move in that. But one way or the other, we will be very transparent. We're going to be meeting regularly on the progress of this. How are we moving? How's the work that's taking place? So what's to come here in the near term? So each of those strategies needs to have a champion related to that. Otherwise, it's kind of a dinghy out there without oars. It's just, we need someone to help steer that and guide it. So various champions were nominated, identified as potential champions were identified for each of those strategies. That works to come, and that needs to be a key next step, because that person's also going to help us identify what are the resources necessary in order to achieve those strategies. What's that resource? What's the timing look like related to that? We need to link the strategic plan to the budget. This is what we're saying is important. And so, I've said before, if you want to know someone's priorities, look at their checkbook, look at their calendar. And we're linking our checkbook, we're linking our work, our calendar to this. This is what we're saying is important. And as we, as the rubber hits the road on this, we need to track and measure progress. And so each goal and its breakout is going to have a dashboard related to it. We'll have regular check-ins, annual progress report. But each of those pieces that we talk to are also going to have metrics associated with it. Let me give for example. When we're saying safer research, develop an internationally recognized, high caliber, high impact research portfolio. That's a goal. How will we know that? What we want to avoid is ambiguity. It's one way, whether it's qualitative or quantitative, we need to be able to say we're making progress towards what we're saying we're looking to accomplish. And so the aims, the goals, the strategies, the tactics, the projects as well, there will be metrics associated with them to say we're doing what we expect to do. It's making progress, we're advancing accordingly. And if not, great. Like I said before, now we know how not to do it. What's the next thing up? What are we going to do? What are we going to take on instead to ensure that we advance this? So with that, let me open it up for thoughts or questions here. Thank you, Liz. I think well of myself, but I know I could have left a gap somewhere in there. Awesome.
I saw the word champion in there and like, oh, I saw the word champions for these projects and what's the timeline? How are we gonna figure out who champions are? Because that's a really key person in all of this, or persons.
We're in the process of identifying this. And as I was listening to Michael, it occurred to me that, ooh, people might be getting nervous out there and saying, uh-oh, this looks like a lot of work. I'm already really busy. But I'd ask you to think about it differently. If what you're doing right now, every day, with most of your time, can't be linked to at least one, hopefully more things on that, we as a department have drifted way off course. So this is really to how do we better focus the work that we're already doing? So it would be scary if we said, this is work we need to do on top of everything we're already doing. But this is how to better focus and refine what we're already doing. And so I encourage you to think about it that way. Other, it's way too easy to get freaked out. But really, do some soul searching. It's like, what can I connect what I do every day to things up there? And then how do we align that? And how do we ensure our most precious resource, which is our people and our time of our people, is used to its best and highest use, and the money to facilitate them getting that work done?
Yeah, and just to add to that is, something that was said on the last steering committee meeting is this is not an intention to say, get ready for more. It's again about prioritization of what's the work that needs to get done. And it's, room will be made for that. And it's not to say, something that maybe gets deprioritized now isn't, a good piece of work or important work. It's what's the right work at the right time. And that's what we'll ensure is that we're going down that path accordingly. Does that answer your question? Okay, what was in terms of timing?
How are they gonna be identified? It's about the champions and how are they gonna be identified? What's the timing for these things? All those important things. I'm not worried about doing more work. I know I have to change some things and keep doing. Well,
So the
Yeah.
question about timing of the champions. So part of the steering committee was asked to nominate people that they thought would be likely people to do this, who might be already doing a big chunk of that as part of their everyday work. And I also encourage us to, let's not automatically think of the usual suspects. This is an opportunity for the next generation of leaders in this department to step up and really shape the future of this department. And you don't have to do it alone. We talked about having, there may be someone that's a little more experienced in that area, but someone that says, that really sings to me, that goal or that strategy. I want to help make that happen. And we can ensure that we pair you with somebody that's a little more senior if you're a junior person. But it's a chance for all you people up there that are not one of the usual suspects right now. Plus, those usual suspects are pretty busy people. And so I really want this plan to be owned by the people of this department. You generated it. It's time to own it and make it happen.
And one other thought is, as you're looking at those strategies, if there's something you're going, that's up my alley. Michael.Cahill at CU Anschutz Studies, EDU, extension 3550. I'm in the north hallway on floor 3. Let me know. I'm all for hearing from you on that one. And it is, part of this piece is we're not going to, say, hey, thanks for being a champion and turn you loose with zero support. Is, we need to baseline a level of common understanding, common language around how we're approaching the work. what's the project management approach, if you will, of, you know, ensuring that the purpose and problem are fully vetted, that we know where we are, where we want to be, what's preventing us from get there, how are we going to get there? So there will be some level setting there as well. So like I said, let me know. Love to hear from you.
Michael, can you address the second half of his question as far as the timeline for the champions to be picked?
Well, we've started reaching out to some already. I mean, you can see we need to find a lot of champions, and probably a question at top of everybody's mind, you know, am I going to get some additional supported time? You know, it depends on who it is, what they're doing, and how closely what the strategy is to the work that they already do every day. So a lot of this is about helping us focus the work we do every day. When we compare what we're doing every day to our strategies and our goals, we might say, you know, that was really important 5 years ago when we started it, but looking at it now, maybe that's less important and something that, you know, and maybe it's outlived its purpose. You know, this is to encourage us to look at that and repurpose our time and our resources.
The goal, the hope is by the end of April at the absolute latest.
Thank you.
For being more specific. And thanks for pushing, Doug. Yeah.
There's a wandering way. We got there.
We have a question online.
Is there an opportunity for the department to view the aggregate de-identified data from the survey that everyone took?
I thought we already sent that out through the strategy, the steering committee. But if not, we have an intranet site where we're going to have data when we get all the champions identified. It'll be on there so people can know who to reach out to. The final slide deck with our strategic plan. And we also want to aim for kind of a public facing dashboard of our goals and how we're going to get there. Our consultants showed us some really cool, innovative ones, I think. They were kind of fun. So hopefully we can come up with something like that. But that's a good question. I kind of thought we already did.
Thanks. This is great. Regarding the slide, your cascading slide with aims, goals, strategies, tactics, champions. It's been said that the world can be divided into lumpers and splitters. And when I look at some of the things we're successful at, it's some of the things that are more lumped together. So for example, we have high visibility, well-funded research that takes place in our practices is directly related to improving the care of the patients that we see in our value-based propositions. We have wellness initiatives that are also work in a similar vein. We also have clinical initiatives that are also directly strategically developed to also help with wellness. So as we think about these different priority areas, strategies, tactics, how are you accounting for some of the cross-cutting nature of some of the programs that tend to be innovative, successful, and have high visibility?
That's a great question, Pete. And one thing that wasn't on these slides that we'll see when we were going through this with our consultants is showing which strategies link to other places. So yeah, they are linked and they're cross-linked. And part of the work of the champions is to that cross-communicate. If someone's doing something around wellness that happens to do with our clinicians, it's going to impact the quality of care. Those two people need to be talking to each other. So, and it's part of our overall goal as a leadership team to connect our pieces of our department. We, as a department, have been asking for that, and we hope this is one of ways we can do it. And if we're not, let us hear about it.
Part of the air traffic control, if you will, of this is going to be keeping track of who's working on what. And so just another way of trying to help ensure catch those as they pop up.
mean, one of the reasons we have these harmonization meetings quarterly, which we have program leaders and administrative counterparts from across the department, is to learn more about what we're doing and when we can link activities together and synergize. What time? Yeah, Jean's here, so I think,
Hi.
right?
I'm sorry.
I think we have time for one more question. If there's anything online, are we good? Okay, well, perfect then. I am honored to introduce Dr. Jean Kuttner. We already told everybody that our delicious lunch is courtesy of the hospital today. So turn it over to you.
Sorry. for sneaking on you.
Oh,
No, this-
no, I'm
this-
sorry, I didn't see you back there.
This'll work. I don't, does this work? And people online can hear? Hi, everybody. For those I don't know, Jean Kuttner, I'm the Chief Medical Officer at University of Colorado Hospital and also faculty in the Division of General Internal Medicine. This is one of my favorite groups of people because I was GIM division head for 12 years, and Colleen and Pete and I have met, and others in the room have many, many years of close collaboration and probably some more wounds to share for it as well. I am here on the behalf of our hospital senior leadership group, and particularly Tom Gurneau and me. Tom sends his regrets. Tom is our hospital CEO. He's on some well-deserved time off this week. And we are here trying to do a little more of a personal touch this year on celebrating Doctors' Day. For those of you who don't pay attention to such things, Doctors' Day is March 30th this year, happens to be a Saturday. And, we've tried different things over the years. And when Tom and I were talking about what to do this year, we said, well, what if we actually food, everybody likes food, and then try to do a little more of a personal touch. And so we are coming individually or together to as many faculty meetings as will let us in the door to just say thank you personally. I mean, what our faculty do here and our trainees and our students and our staff and all. This is an amazing place. I think sometimes we, take it for granted. It's what we know. I've been here since I was a fellow, so this is the only academic medical center. I know, maybe not quite as imbued as Colleen, who was a student here too, right? I missed a few years of training here. But this is such a wonderful group of people. People often ask, why have you stayed at University of Colorado for so long? And I tell them it's the same thing that got me here. When I came here as a fellow now many years ago, it was the people that got me here. It's the people that keep me here. You all are amazing, and just want to express my personal gratitude and gratitude on behalf of Tom and the entire hospital leadership team for everything that you do on a daily basis. And also to know that you can always reach out. I'm easy to find. So please reach out if there's things that I or we can be doing with any of the various hats that I wear to help you do the thing that keeps you going every day. So just really thank you. Anything I can address while you got me here? All right. Well, thank you for all your time, and always reach out if I can be helpful.
Right. Okay, let me, closing remarks here by Liz. Or that one off? Okay.
All right, thank you so much again, everybody, for coming this afternoon. The surveys are in front of you. Please be sure to fill that out. As a reminder for everybody, the next monthly meeting will actually be our Levitt lecture. So the registration for that is in your calendar. It is online. It's in our updates. I swear I'm spamming you with it. So let me know if you have any questions about that. This has been recorded. And as always, if you have questions or concerns, just let me know. Enjoy the rest of your day.